Okay. So, hi, Heidi. Heidi Tvorek is an academic who specializes in information flows, I would say. And she has kindly joined me today because I wrote a column the other day talking about the neutrality problem at the WHO at the moment and how perhaps we need a new body that depoliticizes its current constitution. This proved to be quite controversial. In the column, I actually borrowed heavily from Heidi's work, which is why I thought it'd be quite good to talk to her now to follow up on some of the issues that were raised, because looking at the comments, it seems that a lot of people kind of they kind of missed the key points and have projected their own assumptions, and it's proved quite controversial. So Heidi, thank you very much for joining me now on this Zoom, innovative Zoom Q&A call. Why don't we start off just by you telling us and our I guess our watchers, readers, who you are and how you came into this interesting space of monitoring how information is disseminated by health organizations.
Yeah, well, thanks for having me, Isabella, and for reading the work that I put out there now just about a year ago. So I'm trained as a historian, and I've been working for about a decade on trying to understand the institutions and structures behind information flow. So I wrote my first book about how Germans tried to control world communications in the first half of the 20th century. Ah, there it is, being plugged as we speak, and how they use new technologies like wireless and radio to do so. And I started writing that before the world of disinformation. So people thought it wasn't that interesting. And then after 2015, 2016, they were pretty sure it was very interesting. And then a couple of years ago, I started thinking about other infrastructures and structures behind communications, particularly communications around epidemics. So I wrote an article last year that was about the history of how we got our first international information structures in the interwar period to supply countries around the world with data about potential epidemics and the problems that continue to pose all the way up to the present and how those structures were created. So I've really tried to pair this historical research about structures and institutions with trying to explain the contemporary policy problems that we find ourselves in.
So the paper in question, it's called Communicable Disease, Information Health and Globalization in the Interwar Period. Just how, I mean, you've explained the context, but what actually was the point that made you think, wow, public health organizations have a really interesting information structure? What made you what was the spark that set off the research journey?
Oh, it's a great question. So I guess in the age where we can only research online, it's a good story, in fact. So I was just interested in the history of international organizations, and I found that on the WHO website, they had digitized all of a particular publication called the Weekly Epidemiological Record. So I went and started looking at it, and I would find these amazing maps of how there were information flows from Asia and Africa back to Europe. And these were very unusual maps because they put Asia and Africa at the center. And I asked myself, what on earth was going on? And how did this information infrastructure get created? So that then led me into archives in Geneva and London to try and understand where this system came from and why it was created in the first place, because it was a very, very unusual structure for the time. And then I became fascinated with why it was that states became interested in creating these international information infrastructures after the Spanish flu. Why did it actually happen at that moment when, since the 19th century, so for 70 years before that, states had said they wanted to exchange information, but they hadn't really made it happen. So it was really only after the pandemic of the Spanish flu and a simultaneous one of typhus in Eastern Europe through the League of Nations that you get this system. So that's what sort of sparked this interest. And then when I was looking at it, I realized, hang on a moment, we all think the WHO is an organization that founded all of its structures, but it turns out many of them actually came from the interwar period. And lots of the critiques that we level at this institution, even today, aren't things that can be so easily changed because they're really sort of baked into the foundations of how this organization was created.
It's a really fascinating paper, and I mean, you mentioned the Spanish flu, which until now I think most people would not have really remembered. It's certainly one of those forgotten crises. You remember the Great Depression, or at least we remembered it post 2008, but now this is the crisis that makes us look back to the Spanish flu. So tell us a little bit more about your findings in the paper, because I mean, I'll pinpoint some of the things that I found fascinating, but in terms of how that pandemic sort of sculpted what was to come, and obviously the precursor to the WHO was the League of Nations Health Organization. So how did that all come about, and what were the sort of structures that were developed?
So the Spanish flu starts to emerge right at the end of World War I, as we all now know, having read lots of articles about parallels. But one of the really important things to remember about this, I think, is underreported, is that it has a really disproportionate effect in places like India or Indonesia. So that's one point. And at this point, India is still a colony of Britain. So the people who are picking up on this are mostly British colonial officials who say, this is a really big problem in places like India in particular, where disproportionately more people seem to be dying. And the second realization at the time is there's no good data. We still don't know a century later exactly how many people died from the Spanish flu, and we never will. So these sorts of insights start to flow into the belief that you need to have some sort of international organization around health that can deal with some of these issues. And the person who's chosen to run this new organization is a Polish man called Ludwig Reichmann. And he actually was in charge of Poland's response to the simultaneous typhus epidemic that I mentioned. And Poland is a new nation state, has barely any money. So Reichmann is basically using information to try and isolate these typhus cases. Does such a good job that he becomes the head of the League of Nations Health Organization. And he believes from the beginning that what this organization has to do above everything else is collect information from as many states as possible, standardize it, and then disseminate it out so that officials around the world can decide what to do with that information. But he thinks this is really key, firstly, to prove that you need an international organization. Secondly, to prove its neutrality, because it's gathering information from everywhere, giving it to everybody who wants it. And thirdly, he thinks this is the best way that an international organization can stop disease, because it's in giving officials the information they need to decide, okay, is smallpox coming on a ship? Do I need to quarantine? How should I respond? And that's really where we get the beginnings of, I think, many of the things the WHO still does today, and much of its philosophy.
And the paper really interestingly points out that as these structures developed within the under the auspices of the League of Nations Health Organization, they actually stimulated a lot of investment in the telecoms infrastructure at the time. And it sort of begs the question whether a lot of the international systems and protocols around telecoms would have emerged without that sort of basis in them. So that of course poses a really interesting parallel to today, but we'll go on to that a bit later. But tell me more about the kind of investment side that comes about as a result of all this.
Yeah, so what's actually pretty remarkable about this system is you can see how very different nation states and empires with really different ideologies, everything from democracies to autocracies, etc., all buy into this system, but they do it for very different reasons. So for some, it has an altruism to it. They want to participate. For others, they're new nation states. They want to prove that they can be good members of the international community. For others, like Britain and France, they have big trading empires. So they want to be able to ensure that commerce can keep rolling. So they want to know when is there a disease so we can reroute our ships, et cetera, et cetera. And there are also others that are more militaristic who just want to know where diseases are so they won't invade somewhere with a disease. So I think that's one really important insight that I gained from this research was to understand international cooperation is also to understand that many nations contribute for very, very different reasons. And that's one thing we have to understand at this moment. How can you get a whole bunch of different member states that may be contributing for very different reasons all to stay on board? And the League manages to do this for quite some time. And the other thing they manage to do is to get states to share their communications infrastructure. So one of the big things that this infrastructure does is it starts to communicate with moving ships on the sea using radio and wireless for the first time. This is totally crucial. I mean, it seemed like a completely arcane point until we had the cruise ships during the coronavirus.
Oh, yeah.
Totally critical to communicate with ships, right? Which were communicating disease around the world. And that's what we see with these cruise ships, right? Or even the Navy ship that's now landed in Guam, is that ships are a massive carrier of disease. So one of the reasons this League system is actually successful is they get lots and lots of nation states and empires who have wireless and radio towers to disseminate this information to moving ships on the sea, and the ships can send their information back. So they can say from the sea, we have a case of smallpox, please be aware when we come into port. So these are some of the reasons why member states want to participate, is they see all of this value from this information. But I think we can draw from this, there are lots of different reasons why countries participate, and that you can get an international organization that cleverly piggybacks on the infrastructure of a whole bunch of different empires and nation states. And you see as the 1930s go on, more and more places contribute. The Dutch Empire, for example, because they see the value of being part of this. And amazingly, even the Nazis, after they leave the League of Nations in 1933, they continue to participate in this system until World War II breaks out, because they see the value in demonstrating how wonderful their radio technology is. So you can have many different reasons for keeping countries on board. Again, I think a lesson we can draw for today, that you can piggyback on people's infrastructure. It's not that the WHO needs its own infrastructure, but they can be a coordinating place for bringing together the Apples, Googles, etc. of this world.
And so how does the neutrality of the League of Nations Health Organization evolve, and how does that feed into the origins of the WHO?
So the idea behind international organizations obviously is that they're neutral in times of conflict, and that's one of the reasons that they can gather this type of information. And this for the League is something that continues even after World War II breaks out in Europe. You can read the letters of officials writing back and forth to each other saying, this is one of the successes that we still have, is even though there's war in Europe, we have almost every country continuing to participate. And they sort of can't conceive of health as not being neutral. So they get really shocked. They're just blown away. They can't believe it when, for example, the British withdraw in 1940 because they're worried about the politicization of this kind of information once Germany invades France, right? So this sort of shock that international organizations who say they're neutral actually aren't perceived as such, a parallel with perhaps today, is one that we see in 1939, 1940. Officials keep trying to say and keep trying to maintain their neutrality, and they're really shocked that others from the outside don't perceive it in those kinds of ways. And in fact, even when the system sort of falls apart, once the Japanese invade Southeast Asia, etc., there are sort of a couple of lonely officials still sitting in Geneva, and they keep trying to write all these reports and gather all the information they can, saying, this is the way we will prove that a health organization should exist after World War II. And those people go on to be the founders of the WHO's information system. So there's really a sort of direct personnel carryover. Lots of the publications, they look exactly the same. They're gathering the same sort of data. And I think also this philosophy that one of the things an international health organization should do is collect information, standardize it, and distribute it to others. And maybe put it most importantly for our present moment, there are also some inherent weaknesses in that system that we still see today. So for example, the League of Nations officials are unable to really declare when something is an epidemic. They never really can establish a standard for that. And you can read in these archival documents their frustration saying, we just don't have the ability to decide when something is an epidemic. That's up to officials on the ground. I think that gets, very politicized. And we've seen that in the WHO all the way up to today, whether with Ebola or Zika or now with coronavirus.
So in that context, what is it about calling an epidemic that makes it so highly political and controversial? I mean, how would you pinpoint the politicization in that context?
So I think it's because when you call something an epidemic, it tends to have a whole host of subsidiary effects almost immediately. You're going to get a downturn in trade. You're going to get expectations in terms of what your health regulation should be. And you're going to get a massive loss of, our contemporary context, tourism or other types of visits and so on and so forth. And you may also get various types of perceptions about how good or poor your health infrastructure is. And then finally, from some states, a sense that their sovereignty is being encroached upon if an outside organization is telling them that they have an epidemic on their hands. And in fact, in 2005, something was developed called the International Health Regulation, including by the then George W. Bush United States, with the idea that you would push countries to tell the WHO when they had lots of cases of things. The WHO would declare an epidemic, but would also be the one that was trying to declare when there should be travel bans or not. And the idea there was to take away some of the incentive to be intransparent and to try to prevent these sorts of travel bans. So this now has been part of the extra sort of politicization of the Trump moves, is that technically what Trump did in January was against the international health regulations of 2005, which the US itself helped to write.
Fascinating. So as we move into the WHO context, so it obviously emerged because these legacy League of Nations officials wanted to continue on the work that they were doing, but in a more neutral framework. How successful was its neutrality, and until what point do you think things perhaps became a little bit less neutral?
Yeah, so I mean, all international organizations are always dealing with nation states and member politics in different kinds of ways. And the WHO tries to deal with it in a slightly different way. So it has this very unusual regional structure. So there's the WHO itself, but then there are sub-regions, which have different member states within them. And there's some, political decisions about who was in which region in the late 1940s, but it does mean that there's this kind of structure of reporting upwards. So the WHO, as with all of these other organizations, has to deal with the question of which member states are putting forward initiatives, how much do they want to be involved, how much are they willing to contribute, and the politicization of whether these organizations are attending to the right diseases or are they listening enough to certain member states has sort of always been part of their DNA. I think that's part of those who have not really thought about international organizations very much find themselves surprised at the Trump administration. And there's certainly a great deal to be surprised and dismayed about that the Trump administration is pulling back at this moment. But I would emphasize the history shows us that international organizations are always getting politicized in different kinds of ways. And just sort of a brief side note reminder that actually, although no nation state has ever left the UN as an umbrella organization, the US has left or withdrawn its funding from other UN agencies, and so have other nation states. So for example, the US has pulled its funding from UNESCO several times. Britain actually pulled its funding from UNESCO in the past and rejoined. I can't think of another example though, where a country has pulled back in a moment of pandemic. But I think the basic sort of point here is international organizations want to be neutral, but there have from the start been politics about what they attend to, who the funders are, and how they're constructed. And that's one of the sort of internal tensions within international organizations that's really just been thrust to the fore at this moment by the Trump-China debates.
So I want to ask about the funding situation, but before we do, perhaps just some context about when the WHO was at its best. One could argue you might point out that it was when it eradicated smallpox, and that was really an example of it kind of overcoming all these pressures in many ways. So what was special about that period, and how come it's evolved from that point, and tell us a little bit more about what happened back then.
Yeah, so when the WHO is founded in the late 40s, it starts to adopt this philosophy that what it really wants to try and do is really ambitious global projects to eradicate diseases. So it tries initially to eradicate malaria. This was sort of using DDT, which we now know is a very, very dangerous chemical, and spraying this on fields around the world. It doesn't eradicate malaria, although now some historians argue it's actually much more successful than we thought it was, because it dramatically reduces the incidence of malaria in places like India. Then the WHO, on the suggestion mainly of the Soviet Union, starts to get involved in the idea that it could eradicate smallpox. And this is something that historians like Erez Manella have written about as a sort of success story, because the WHO ends up being a broker between a mainly US funded campaign where the Soviet Union is supplying the vast majority of the actual vaccines. And by the time we get to 1977, the disease is effectively eradicated through vaccination. And then in 1980, the WHO declares smallpox is dead, because you have to wait 3 years with no instance of disease before you can declare that it's eradicated. So I always do a lecture about this in my history of international relations as an example of how actually, in this case, the WHO serves as a broker between these two countries that are in the middle of the Cold War, and yet they both contribute through the WHO to eradicate a disease that had been around for centuries and centuries, and that we hadn't been able to eradicate since the 18th century. So I think there are great examples where the WHO actually does serve this kind of neutral broker function. So we shouldn't think that it's just a history of failure. There are these moments where it succeeds as well.
But the funding side of it is really important. That becomes more important as we come nearer to now. So tell me a little bit more about why the funding is so key to the politicization. And I guess my query is also, or rather like, I guess the point that sometimes people overlook is something you already mentioned, which is that everyone's in it for a different reason, which means everyone sees the politicization slightly differently as well, right?
Yeah, I think that's right. I mean, the funding of UN agencies comes from member states, right? And so the US is by far the biggest contributor, both to the UN itself overall, and then to specific UN agencies, which is why the withdrawal of US funding is so particularly devastating. Now, there have been arguments within the US, I'd say sort of over 20 years, about the funding of the UN, complaints from various types of people about it. So I wouldn't want everyone to think that Trump is the first person in the US as a politician to suggest that they don't want to spend as much money on the UN. But it is, in the case of the US, a very, very powerful tool. I would say that the other thing specifically about the WHO, though, is that its sort of status has started to change as you have so many philanthropies come up in the world of international health, particularly the Gates Foundation, which has been really critical in putting a laser-like focus on trying to eradicate or eliminate certain diseases versus others. And so that's really changed the power structure of what the WHO is doing, because the Gates Foundation also exists as something that puts its efforts into different types of diseases and with which the WHO cooperates to a certain extent. So there's in a way sort of two aspects of the US part of this funding. There's the US government, and then there's US based philanthropies like the Gates Foundation. So I think that adds to, we could call it politicization, or maybe this even takes us into, conspiracy theory land, where some of the people who have conspiracy theories around coronavirus and Gates have sort of now glommed onto the Gates Foundation, WHO connections and so on. So I think we need to also, in the WHO case, tear apart that there are these two aspects of funding which can unintentionally lead to some of these beliefs about it being politicized.
So what would be the theory in terms of how that impacted its sort of decision making with the Ebola outbreak and also with the early phase of coronavirus? Because the criticism is obviously from the US that they were far too, they appeased the Chinese position far too much than they should have done.
I think this is a really complicated point,
Yeah.
right? Because the WHO is, as the League was, the place that is trying to gather data, but it is ultimately completely dependent on those states providing reliable data and letting the WHO in. So WHO teams did visit China. And of course, there's always a question as to what they can get to see, but there's a back and forth there as to how much access they're going to get. So you can argue this is a delicate dance and game to try and ensure that you're trying to keep all these nations on board. So I think there's going to be a lot of, and then this is what Tedros, the head of the WHO, has himself said, there's got to be now some thoughts and looking into how the WHO tried to create this balance at the beginning. But I think recognizing this is the inherent tension within the way the system was built, right? The WHO does not have people on the ground everywhere measuring disease. It is dependent on member states reporting to it in a standardized way. It is the broker. And that's exactly the same problem the League had, right? Were the numbers reliable or not? Well, you did your best to push people to give you reliable numbers, but certainly there are problems with the transparency, the capacity to gather numbers. And then in the Chinese case, I think, a lack of understanding about disease at the beginning means that you can very easily miss a huge amount of this. So do we need to know more about exactly why the WHO said things that they did? Yes, I think the WHO itself recognizes that, but we also have to understand the delicate game that it's playing, trying to make sure that it keeps as many member states on board as possible to actually give them the information that they need.
It's a bit of a side point, but I found myself reading the UK pandemic flu plan today, which was, I think the original was in 2011, post swine flu. And what I found quite interesting in that was there's a section there which talks about how in the plan, they can't be sure that the data coming from other countries is reliable, and that it's not until they start having homegrown cases that they can actually scrutinize if, basically there's an assumption that you can't trust the data. And it's not just because you can't trust whether a foreign country is doing things properly and being transparent. It's also the impression I got from reading it, the fact that the cultural factors or the nation-specific factors regarding everything from like demographics to weather and blah, 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 they actually impact the way the disease spreads anyway. So you can't assume your numbers are necessarily going to be the same as another country, which I thought was quite interesting in that context. So there is this sort of it seems to me there is a continuing sort of need for every country to sort of cross test their own numbers anyway, which I hadn't really appreciated, but in that context it makes a lot of sense. So, and then there's I guess the WHO is sitting there as the broker, but it's not got that sort of because it's a neutral international organization, it doesn't come at it from the same perspective as, say, another nation state which wants to cross-examine how those numbers compare with their own numbers. And obviously if there are any discrepancies, it might look hugely sinister, but it might not be. It might just be a reflection of different variables in the underlying cultures and demographics, right?
Right, and it just, this gets into the weeds of statistics, right? That there are many different philosophies behind how you collect statistics. And this is one of the things that the League and the WHO have tried to do since their foundation, is to create really standardized categories for things like these statistics. But with a new disease that is emerging, we see every country is taking a slightly different approach, so that any of the graphics that we're creating, any of the statistics have to come with an asterisk, that everybody is doing it in a slightly different fashion. And so the WHO is going to try and standardize, but it doesn't mean that there's something sinister behind the numbers being incomparable in different ways. It just means that you cannot necessarily compare numbers of even deaths or cases, because you need to know the denominator and you need to know healthcare capacity, et cetera, et cetera, et cetera. And so it's always sort of interesting to read in the archival documents how at least the League and then the WHO are always trying to get countries to compare and to gather in comparable ways, because they recognize this from the beginning as a really problematic aspect of getting any of these numbers, is you have to provide people with things that are comparable also, so that later you can actually do real studies on what has occurred, because otherwise we find ourselves unable, as we move through this pandemic, for example, to really know whose approaches have been more or less effective if we haven't actually measured the number of cases, right? We need to have something comparable to know, has Germany actually done better than the UK? Have we actually captured everybody who has passed away, et cetera, et cetera? So these are, I think, again, these are structural problems. And a lot of people who are talking about this now, they see them as problems just of the coronavirus. And my sort of policy point would be, no, some of these are really structural things. So they require a very different solution than just coronavirus specific. This is a really structural problem where we need to think about, okay, how many countries can we get on board to do the same type of statistics? How feasible is that? What would we need to know in those underlying statistics? And I think that the UK's plan that acknowledges there are going to be all of these different variables is a very good thing in the sense that you don't rely on another country's numbers to dictate what you are going to do within, say, the UK or in New Zealand, Australia, etc.
So what frustrates you in the current sort of, Twitter conversations that are being had when it comes to sort of data information flows and the blame game that's going on? As someone who studied all this for such a long time, what are your sort of frustrations or observations?
So I guess one of them I've already said is, the belief that this is somehow related solely to the coronavirus versus understanding these are actually structural problems that were somewhat predictable, right? As you said, I published this article in April 2019, long before the coronavirus existed. So you could identify some of these problems by looking at structures. So I think that's been one of my major frustrations, that we really need to get to that conversation. Number two, I think the inability to do really good international comparisons about what is happening. So rather than, this is something I'm intending to work on now, rather than just saying, South Korea looks good, to really try and get a good grip on what was it that made that response smart? What was it that meant that seems to be more successful than others? Was it, I think we have to go beyond the sort of cultural explanations alone, and try to understand what is it about how governance works, how the state works, in some places. So that's another frustration, is to get beyond simplistic comparisons and get into some real weeds about what was going on there and what we can learn. And maybe the final one is just to say, I think we've spent a little bit too long misrecognizing that communications really is a medical intervention. So it's something that can honestly save lives. More effective communication increases compliance, that decreases the spread of the disease. It really is fundamental. It's not like the icing on the cake. It is, you know, the butter in the cake, as I like to talk about it, because it's so fundamental. And if you do it well, like when you bake a cake with butter, it disappears. But if you don't do it well, the cake is sort of dry and inedible.
So, I mean, in terms of, because obviously there's also this misinformation factor that's going on at the moment. I mean, the really, you know, crazy conspiracy theory about the 5G causing coronavirus. And I find it quite remarkable how much airtime it's getting, and how something that is, to me, quite clearly absurd is being propagated, and people are really kind of believing it. And it's not being propagated obviously by the mainstream, but it's going through social networks. And I'm just wondering, is there anything comparable with other pandemics, and cui bono? Who, I mean, if it's not true, who originated that rumor, and why now, and you know, what is there to gain from it?
Yeah, so I can't think of another specific example of a pandemic and fear about a technology, but fears about new technologies has been quite widespread in the past. So in China, for example, in the 19th century, there were fears that telegraph cables would disrupt feng shui, or in the Ottoman Empire, people thought that telegraph cables were a sign of a sort of pagan and devilish Christian West imposing on Islam. There are other examples in, say, North Africa, of people sort of cutting down wireless masts because they thought that they were somehow evil as well. So this sort of fear of new communications technologies and what they could do, I think has a long history. And then I guess the other part of your question, why this stuff, who's benefiting from it? Having done previous work on sort of fake news or disinformation, there's one really simple way is to try and break down the different categories of who's doing it. So there's a sort of political aspect, which we spent a lot of time focusing on. There's domestic actors, and then there's the international. But we, I think, spent a bit too little time thinking just about the economic gains for this. That potentially, you know, if you're the infamous Macedonian teenagers who started spreading pro-Trump things because they made more ad dollars, because they got more page views. And so I'd love to see some more research seeing who is spreading or writing these articles. Are they potentially making money? Particularly simple things like when the US dollar is strong, the incentive to do this for economic gains is much higher. And if we have a strong dollar, as we do now, how many of the rumors that are being circulated have those kind of economic motives behind them? And then the final thing I'll say is, I think in times of deep confusion, people seek simple answers to complex questions. We've seen this with the anti-vaxxer movement. And I think the 5G is another sort of psychological version of this, where although it seems like a very complex conspiracy theory, it's something to blame that is concrete. So there's a sort of human psychology element to it, along with the cui bono question.
And I mean, the anti-vaxxers are going to be suddenly really prominent because, you know, it was a marginal conspiracy for a long time, but now it's going to kind of move right into the central space, because obviously a vaccine is seen as the long-term sort of exit strategy for everybody, right? And then there's this correlation with Bill Gates pushing it, and I guess that comes back to our issue of neutrality. Is like, how do you solve a pandemic with a vaccine when you have this like feedback of information that actually enforces the conspiracy theory, in part because of who's financing the WHO? And it's a tricky one, and I don't really see how you can untangle it without sort of massive re-education, which is obviously costly and not necessarily going to be effective.
Right. And this goes back to my point that communications is going to be a medical intervention here, because if you do not have 95% compliance, you are not going to get the herd immunity from this vaccine that you need. So this is why we have to start. There's sort of the first bit of communications, which was getting people to adhere to physical distancing. There's a sort of medium term of how you get people to comply with whatever we're going to land up with. And then there's the long term of how are you going to build people's education and sensitivity to vaccines. And maybe even on top of that, the real work between governments, social media companies, and civil society to figure out, okay, what's the real regime we're going to have here? How are we actually going to deal with this sort of misinformation? What are the policies, but also what's the enforcement? And then how do we preserve freedom of expression? These are things I've been, talking about in other arenas, thinking about elections, hate speech, etc., for years, and the health bit was always on the side that I was paying attention to, but now it's absolutely at the center. So it's accelerated, I think, a lot of these conversations about how we deal with the rampant disinformation that's spread on social media. And we now see this is going to have real, this has vital life and death consequences if we get this stuff wrong.
Absolutely, I couldn't agree more. And I think that's a really good place to sort of wrap things up. And I mean, are there any sort of closing thoughts with respect to what's going on at the moment with Trump and the evolution of the WHO? What's going to happen if that funding is pooled? Is that going to put somebody like Bill Gates even more at the center of things? And how is that going to play out in terms of continued neutrality? Just, closing thoughts.
Yeah, I mean, I think one thing that we haven't mentioned is that the WHO is so critical for developing countries, and I think this is a real worry. Nobody is saying the WHO is perfect, but what it does is just so crucial for many countries that have really underdeveloped health infrastructures, and we've been seeing the devastation in places like Europe and North America, and it doesn't even bear thinking about in countries where the number of ventilators they have barely scrape into the double digits. What will happen there. And so this is, I think, the really big worry is what does the lack of funding for the WHO do for places like that? And maybe the final thing I'll say is the unusual structure of the WHO means that you can actually donate directly to it. So I will be very interested to see if any of the major sort of billionaire philanthropists from the US or elsewhere will step up to fill the gap now that Trump seems to be withholding this funding. That would be a very interesting development.
Or maybe philanthropists with offsetting political beliefs to Bill Gates, and then you get a sort of neutralization. Yeah. You might see the Koch brothers along. I don't know.
Who knows?
Yeah.
But the WHO, for all its many faults, for now there are certain things that it does that no other organization has the infrastructure to do immediately. So I think we can use this history to understand, okay, this is where these flaws have come from. That doesn't mean that we don't need something. We can think about how to fix it. But in the meantime, it is the best that we've got to try and prevent this becoming an even worse disaster in some places where there are only a couple cases right now.
Couldn't agree more. Thank you so much for your time, Heidi. That's been really fascinating. And I would advise everybody who is still interested in this to actually read Heidi's work, both her book, which is News from Germany, which takes things more into the misinformation sphere and the propaganda sort of aspects of what was going on in the interwar period, but also the key paper. And I'm sure you'll be coming out with more stuff soon, so we will keep an eye on it. Thank you so much, Heidi.
Thanks for having me, Isabella.
No problem at all.